Hello, everyone. Okay, I'm going to do my best to keep this to 5 minutes, mostly so that I don't ramble on forever. But first, like, I'm having one of those moments where I'm like, I do not want to study. I do not want to study for this. I do not want to take this test because it represents the man and I don't want to do it. I don't think the tests are bad. I think the tests are good. And I think the tests are meant to help people shine and that they need to be developed in a way that really shows off your knowledge and helps you to be a better practitioner, which is why I chose the National Clinical Mental Health Counselor exam versus the National Counselor exam, which is a multiple choice kind of knowledge based exam. It is statistically more people pass the NCE versus the NCMHCE. And I'm one of those people that did not pass this test the first time, the case study version. And so today I'm reflecting on treatment and for the universe. And if it's helpful, perhaps I'll call this video study tips for the NCMHCE. Case study. We have a client, 14-year-old, presenting with ADHD, and according to this conduct disorder. Now, here's a brief reflection here. I know that there are times when our fellow human beings make poor choices. I know that those choices influence other people. I know that sometimes those poor choices mean that individual probably needs to not be included in a given setting or society. Okay, I get that. I'm not sitting here in this utopic passive world where I think like, hey, like everybody can just be together. I get it. I get that sometimes, and we're going to call this person George. Okay. In the case study, they are listed as heterosexual cisgender male. Okay. So we're going to call them George. So George is presenting with his conduct disorder. In the case study, we see that George has no connection with father and has a very limited connection with mother, who prioritizes work and social life. Based on the case study, this is not my value, who prioritizes work and social life over time with her son. So child is presenting with bullying, difficulty paying attention in class, and getting in trouble at school. Child says in the intake session with the counselor, what does he say? Oh gosh. He says this really important thing. Essentially, right, that he spends all of his time playing video games, and that he resents his mother for not being with him. That is going to result in a conduct disorder. So I struggle a little bit when this test, it seems very value-based, and it is coming from a very like archaic clinical value that this child is somehow responsible for their behavior. I get it. They need to choose what to do. This child needs to learn skills. But when we come into the room, and this is the guidance that I'm like really reflecting on and struggling with, is it says what objective does not need to be prioritized in George's counseling treatment plan? A, family functional interventions. B, processing trauma and learning coping skills. C, learn pro-social behaviors and implementing changes. Or D, referral for psychiatric testing and evaluation. I get that safety is our priority. I get that as counselors, we are not people's saviors, that they have to be the savior in their own life in that way, or to be able to develop the skills and the tools and the interconnection to find strength and healing. I get that. I'm not trying to be anybody's savior. But in this, they say that the correct answer the so I said the one, like the correct one. Sorry, that was like 30 seconds of pause. I want to make sure I was telling you this correctly. Right, the one that does not need to be included is family functional interventions. I said the one that does not need to be included right now, like doesn't need to be prioritized, is a referral for psychiatric testing. Sorry, I just like had a moment of not being able to talk. Referral for psychiatric testing and evaluation. So I come at counseling from a person-centered approach. How is like that? That's just getting the job done. I like, oh, okay, I have this child who, by the way, like I can see in the room that mother is not nurturing or caring for or supporting. Child has said, I resent my parent because they don't show up. Child is my client. Child is my client, right? So first things first, you know what we're gonna do? We're gonna get you into a psychiatrist and we're gonna get you tested so that what? We can medicate you? I it makes me deeply frustrated and deeply emotional because how many children are getting slapped, with a conduct disorder? Then nobody wants to work with them. Teachers see them as a bad kid. We see this through the literature everywhere. It's that the minute you get that label, ADHD included, the minute you get that label, I've heard this about my own children. Oh man, that's such a good kid. They're just really distracted. I understand that a referral for psychiatric testing and evaluation could be extremely helpful, but in terms of prioritizing care, what is going to help George the most? What is going to support George the most? And I get it, this test is probably like, I just keep telling myself, don't get sued. Like, go from that perspective, which I wasn't. I was going from my value based perspective, which was I would want to help this family if they want it, right? Like, that's not my job to say you need this. But if they want it, like to connect with mom and to say, like, hey, he needs you. And to help George to find other strengths, other relationships that will help him to find some sense of purpose. I was studying disassociation the other day, and one of the theories is that so much of dissociation happens because of our disconnect through trauma. Not just our disconnect from our body, but our disconnect from our people. So I know that this person isn't real, but I really feel like they represent real people who, and especially young people. Like, I work with adolescents and young adults. Like, that's my wheelhouse. So this is 8 minutes of reflection. If you've stayed with me, um, to say that I disagree. I disagree that a referral for psychiatric testing and evaluation is one of the primary things that we need to do. I think that for all the reasons that I just shared. So I hope that wherever you are, I hope that if you've been, that for whatever reason, why you're watching me today rant and rave about this, or maybe you're studying for the test and this is going to be helpful, is pass the test. Right? Like, that's where I'm at, right? I'm so close. I'm like 4 months away from finishing my clinical supervision hours. Um, right, so I'm trying to ramp this up and just be really prepared for the test. Pass the test. And then go be a really good counselor. Go be a counselor who loves their clients. Have appropriate boundaries. Have appropriate boundaries. Okay? But care for them. Because a conduct disorder is just a label. It's just what a bunch of people in a room decided, like all of these really aggressive or frustrating or hard to work with symptoms, like that's what that means. And help them. Help them. And if psychological testing is what they need, great. But if family interventions is what they need, do that too. All right. Soapbox over. I totally did not make my goal. I actually blew it over the water by half, out of the water by half. I'll be back in again in a couple days, hopefully in a better mood. All right. Bye.